The best choice in this case is calcified cephalohematoma. Let's look at some of the features that make choice C the best answer here. First of all, you see this very well corrugated lesion that's expansile overlying the right side of the skull. Now, there's no aggressive process such as bony destructive process or a aggressive appearing periosteal reaction. So even though the lesion looks expansile or the cortex is intact, looks relatively benign. Some people refer to this as double skull sign, and you can see why. Look like there's a two outer table and inner table. So there's expansion, the double skull sign. Notice that this lesion does not cross suture. You can see clearly there's a coronal suture in the front, and there is a lambdoid suture in the back. And that is important for cephalohematoma. So for cephalohematoma, it's a subperiosteal hematoma, so therefore it does not cross suture. Is typically traumatic, especially during birth. Now compare this to subgaleal hematoma. In this diagram, you can see there's differences between cephalohematoma, which is bound by periosteum, so it's a subperiosteal hematoma, therefore it does not cross suture. On the other hand, subgaleal hematoma is sitting above the periosteum, so it can cross suture. Therefore, subgaleal hematoma has the potential to be more diffuse and sometimes can give patient more trouble in terms of blood loss. Again, the big distinction between subgaleal hematoma versus cephalohematoma is that cephalohematoma does not cross suture like in this case. What about other choices that do not work as well in this case? For example, choice A, cranial synostosis. As you remember, cranial synostosis is due to premature fusion of the suture. Here you can clearly see all the major sutures such as sagittal suture, coronal suture, and the lambdoid suture does not close. So this is not cranial synostosis. This is an example of cranial synostosis, particularly unilateral coronal suture fusion. On the left side, you can see the coronal suture is open. On the right, it's prematurely fused. Therefore, there's asymmetric expansion in the transverse dimension on the right side. If both coronal sutures are closed, the head will be elongated in the transverse dimension, will be narrow in the AP direction. If the sagittal suture is prematurely closed, the skull will elongate in the AP direction, but will be much more narrow in the transverse direction. What about choice B, LCH? This is an example. 3-year-old female has LCH. You can see that that's often referred to as a punch-out lesion. It's very clean and usually does not have a significant sclerotic margin, as in this case. On the CT, because you can see that there's often asymmetric erosion between the outer table and the inner table, therefore on the X-ray, they can look like a bevel edge or a hole-on-hole appearance, such as in this case. If you put on soft tissue window, as you can see, there's also a soft tissue component of LCH. Neuroblastoma metastasis, choice D. This would be an example of 4-year-old with neuroblastoma metastasis. You can see there's a very aggressive appearing periosteal reaction. There's associated mass lesion, sometimes intracranially, sometimes extracranially, sometimes both. This is coming from neuroblastoma met. Again, a very, very aggressive lesion. Sometimes you can see aggressive bone destruction. In this case, you see aggressive periosteal reaction. Lastly, epidermoid cyst. An intraosseous epidermoid cyst tend to have a clean margin, often at or close to the suture. If it's extraosseous, often they have a scalloping of the adjacent calvarium. On the soft tissue, you can see the internal consistency is relatively hypodense. It's epidermoid cyst. Another confirmatory test you can do is do MRI. If you see restricted diffusion, bright on DWI, relatively dark on ADC, that is pretty good for epidermoid cyst. Overall, the best choice here is C, calcified cephalohematoma. Overall, this has a very classic appearance of a double skull sign, relatively benign appearance. It is important to recognize calcified cephalohematoma rather than misdiagnose them as something more aggressive. That's all for this pediatric neuro case number 13. Thank you for your attention and good luck on your board exam.